Now I'll try to address one or two inflammation in the soft tissues. This one usually occurs around the joint. Okay, I will talk about the bursitis, which is what inflammation of a bursa. Okay, we'll talk about tendonitis. We'll talk about synovitis, which is inflammation of the synovial membrane. Okay, so I think that's what we got. So let's look at them. So the first is bursitis. So bursitis, to say that in general, okay, those three conditions, right? They are common causes of what? Musculoskeletal pain and swelling. They often overlap in presentation, but they are different. You understand? They are different. It's not the same thing. So what we got here is this. Bursitis is just inflammation of a bursa, which is what? A small fluid-filled sac that cushions between bones, tendons, and muscles. So it could be repetitive motion, trauma, infection, systemic conditions like gout. Alright. Also rheumatoid arthritis. So common sites, it could affect the shoulder. Could affect the shoulder, could affect the elbow, affect the olecranon, affect the hip, affect the knee too. The knee could also be affected. So symptoms is there's localized pain, there's swelling, tenderness, and the place is becoming warm, and pain worsens when you try to actually use that joint. Management, the person should rest. They use NSAIDs. Eye is the place. Then you can actually aspirate, the bad things out. Okay. So tendonitis on the other side now. It's inflammation of a tendon, usually at the site of insertion. But from the site of insertion, it could actually now go up, go up, go up, go up. You understand? So for that's what we got. It could be due to overuse, it could be due to repetitive strain, it could be due to poor biomechanics, age-related issues. So common tendons that get inflamed include the rotator cuff, the Achilles tendon, the patellar tendon, the wrist extensor. Okay. So that's what we got. So symptoms, there's a lot of pain when you try to move that part. There's tenderness along the tendon. Sometimes it could result into what? Swelling, and some noise is coming out from the joint, that's crepitus. All of that. So management, the person should rest. Stop using that place too much, Eyes, NSAIDs, physiotherapies. Alright, the synovitis is just simply inflammation of this synovial membrane. That's the synovial lining. Okay, so synovitis is inflammation of the synovial membrane lining of the joint, and that's the place that actually produces all those lubrication, So it could be caused by several things: autoimmune disease, trauma, infection. Sometimes it's the position of crystals there, So common joints that are usually affected include the knees, the wrist, pain, and wrist fingers rather. Okay, the rest of it. Symptoms is, joint swelling, warmth, stiffness. Okay. Pain, reduced range of motion. The rest of it, you manage with the same thing: NSAIDs, corticosteroids, and also disease modifying drugs. Okay. If it is infection, then use what? Antibiotics.